I had a massive heart attack on May 12th, 6:15 a.m. in the morning. The EMS came and people told me, because I don't remember, that they laid me on the floor and I was sweating profusely. They were going to take me to a Brooklyn hospital, and I kept begging them to take me to NYU.
This patient came to our emergency room at NYU Medical Center by ambulance with severe chest pain and was diagnosed immediately with a massive heart attack.
The patient's condition was critical. He was unstable in the fact that his blood pressure was falling and almost non-existent.
His prognosis was extremely poor. He had a clotted off left main coronary artery, which was acutely closed, and that carries with it at least a 90% mortality.
A staged approach to a severe heart attack like that, as we practice it here at NYU Medical Center, with a multidisciplinary approach. The initial evaluation is performed in concert with the emergency room doctors, heart failure specialists, interventional cardiologists, and cardiac surgeon.
And of course, in addition, we had nephrologists, infectious disease, pulmonary people, and critical care all involved in this patient's care.
Thank God the EMS man broke the rule, because he said to his partner, "This fellow has no pulse, we have to get him to a hospital. Let's just take him through the tunnel, let's go to NYU."
At the time of his arrival, if you have a completely occluded artery, a left main artery, the prognosis is extremely poor. Many patients will never make it to the hospital. I believe it is fair to estimate that 8 or 9 out of 10 patients with such a diagnosis die.
It became clear that his only chance of survival would be an emergency coronary artery bypass.
However, there had been so much damage to his heart that he still remained in cardiogenic shock. The heart was not able to deliver enough blood to the rest of his body, despite maximal medical support.
And despite placement of what we call an intra-aortic balloon pump, the patient continued to deteriorate. At this time, our team decided it was best to take him to the operating room for immediate coronary artery bypass grafting, which is a cardiac surgical procedure to restore blood flow to the arteries in his heart.
As a matter of fact, he was just about in full cardiopulmonary arrest when we arrived in the operating room, and we were performing CPR at the time.
Again, in consultation with our interdisciplinary team, it was decided to place a left ventricular assist device, which is, in simple terms, a mechanical heart.
The purpose of this device is actually to replace the left side of the heart. So it removes all of the blood from the apex, from the end of the left ventricle, and then with its own power supply, pumps it like a heart would into this aorta and supplies the body with blood.
When I woke up 2 weeks later, after being put into a coma, and the doctors fighting day by day by day to save my life, telling my wife at the time of admission that I had less than 10% chance. As I got better, they told me the truth, that I really had no chance medically, and they took all the rules and all the rule books and basically tossed it out the window to save a man's life.
Over the near term, he's going to continue to do well. And now that all his tissues are getting an adequate amount of oxygenated blood, he's recovering nicely.
So his outlook is excellent, and considering where he started with a survival chance of maybe 10%, he now has a survival chance over 90%. So his prognosis is outstanding.
Well, Mr. Bira is home now, and he has this device in place, and he only needs to carry a battery pack with him, which is small, can be placed in a backpack or over his shoulder, and he can walk around, exercise, go to the movies, go out to dinner, go in a car. There are people that work while they have these devices. They're incredibly mobile. And all of this is very important, as he needs to get his body in condition for a heart transplant.
Without these doctors, I wouldn't be sitting here. Everything happened in my favor, and these doctors being here literally saved a person's life.
Mr. Bira surviving is as close to a miracle as you can get in medicine. He could have died at any point along the way, and he almost did. The fact that the ambulance brought him to NYU, a place that has all of these services available, all of these doctors available immediately at all times, is probably what saved his life. If you take him to a hospital that doesn't have probably each one of these units, then there's virtually no chance of survival.
Not knowing who I was when I came in, I was a patient lying on a table, but as time went on, we developed a very close and special relationship. Doctor to patient, patient to doctor, friend to friend. These people have become a big part of my life, and I wouldn't go anywhere else, and I thank them all.